Welcome to the Cystic Fibrosis Foundation CF Education Day, Partnering for Care, Help Your Nurse, Help You Thrive. I'm Leslie Hazel, Director of Patient Resources at the Cystic Fibrosis Foundation. This webcast is hosted by the Johns Hopkins Cystic Fibrosis Center and supported through an unrestricted educational grant from Genentech. It is a part of the Partnering for Care series of webcasts that focuses on the different roles of the healthcare professionals in your CF center and how you can partner with them in order for you or your child with CF to thrive. Anyone with cystic fibrosis knows that it takes a team in order to care for the disease. And you're not alone, because this team includes you, the person who has cystic fibrosis, your family, your friends, and the healthcare professionals at your CF center. Partnership is when a person or persons take part in an activity with others. This activity is CF care. Partnering with your CF healthcare professional is important in order to help you thrive and to learn how to fit CF into your life versus your life into CF care. This presentation will focus on how you can partner with your CF nurse to learn about cystic fibrosis and to manage the disease. Questions not related to this topic will not be asked or answered, and the questions were submitted by you, the CF community. If you have additional questions, I encourage you to talk with your nurse at your CF center, or you can contact the Cystic Fibrosis Foundation at 800-FIGHT-CF or info@cff.org. Joining me tonight is Meghan Ramsey. She is the nurse practitioner in the Adult CF Clinic at the Johns Hopkins CF Center in Baltimore, Maryland. Welcome, Meghan.
Thank you.
So my first question is, how do you keep up to date on the practices, and how do you know what's going on internationally?
I read professional journals. I read the cystic fibrosis practice guidelines that are put out by the Cystic Fibrosis Foundation. I also attend the annual North American Cystic Fibrosis Conference. I also collaborate with others in the CF community, other CF experts, as well as other colleagues about cystic fibrosis through collaboratives at the conference and on listservs as well.
So what exactly is your role on the CF care team?
I am the nurse practitioner for the adult program. I also am the nurse coordinator for our program as well.
Okay, now I have to ask, what's the difference between a nurse and a nurse practitioner?
I think a lot of people have that question as well. I'll start off by first saying I'm a nurse practitioner, and this can vary from state to state, and also how centers may use their nurse practitioner can vary between centers. In our state, in Maryland, I am able to see a patient, I'm able to assess them, diagnose them, treat and prescribe. I can see them independently. I have a written agreement with a physician. Within our CF center, I will see patients in conjunction with our physicians, and I am able to prescribe and treat patients over the phone or in clinic.
So an adult actually sent in this question, and that is, they wanted to know, when should they contact their CF center other than for their every 3-month appointment? You know, they never really feel good, so how do they know when they need additional medical help or they need to talk to somebody? How do they know that?
That's a great question. It's really important for patients to know what their baseline symptoms are. Once they can understand their baseline symptoms, they'll notice if there's an increase in these symptoms, such as maybe an increase in cough. Over 3 days with an increased cough, you definitely want to be in contact with your CF center. If you notice an increase in your sputum production, maybe the color of it, the consistency, maybe you may be streaking some blood, this is very important to let your cystic fibrosis center nurse or your team be aware of these. If you have a fever, if you've come in contact with someone who has been ill, especially during the flu season, that's extremely important. If you've had problems with taking your medications or treatment related to adherence issues or maybe insurance issues have caused a problem.
So it sounds like pretty much anytime you have a question, call the CF center and talk to the nurse. Okay. So another question came in, what is the most effective way to communicate with the CF center? I mean, email is so prominent. Why, some centers may use it, some don't. What's the best way to talk to the people at the care center and the healthcare providers?
And this can also vary from center to center, how other patients are able to communicate with their CF team. We have a phone line. We take sick calls on the phone line. We take prescription refills and other administrative or non-urgent issues. We do have email addresses, and we do have a fax machine. We will take information from a fax machine and from email. Although email is not always safe, sometimes the confidentiality can be broken because it is on the World Wide Web. And also, it's not always monitored. I can't say when we're over in clinic that it gets monitored the best. And if someone may be out that day, and if you're emailing them, they may not be getting the information until the next business day or even later than that, which would not be the best for your care. Our phone lines are always managed during business hours, and that is really the best way to contact for our urgent issues.
So you mentioned that the phone lines are managed during business hours. What about weekends or the middle of the night? What kind of coverage is available?
Every center, again, may be a little bit different on this and how they handle their after hours or weekend on call. We have on our phone line, it gives information for our patients to call the hospital on-call phone number, and they can be in contact with our pulmonary fellow on the adult team. This pulmonary fellow will answer their questions and help guide them, but they can also get in contact with the adult cystic fibrosis team if need be. If a patient's having emergent issues, they need to go to the emergency room. And at the time that they're going to the emergency room, they can either get in contact with the pulmonary fellow to alert them or make sure that the emergency room contacts the cystic fibrosis team to provide optimal care.
So I know you've talked about this a little bit. What are the, go over one more time, the information that you, as the nurse in a CF center, that parents or family members or spouses or the adult with CF should tell the nurse. Just one more round through.
Again, this goes back to knowing their baseline symptoms. So if they notice an increase from their baseline symptoms, that's very important for us to know about. Again, the sputum color, consistency, and how much they're coughing, any of their symptoms that they're having, that have been increasing from their normal baseline. Shortness of breath, chest tightness, all that is extremely important, as well as medications that you're doing at home. We are prescribing certain medications. We may be assuming that you're taking them, but what we really need to hear from is what you are truly taking, how often, and how much you may have missed a medication. The other things that are important to know is how has your illness affected your daily activities? Because this tells us a lot about how you're feeling about your disease process. Have you missed school or have you missed work? It's also important.
So you talked about briefly emergent issues. What would be defined as an emergent issue?
Emergent issue is something that either A, could be considered life-threatening or needs immediate medical attention. If you're coughing up blood larger amounts, if you're having difficulty or inability with breathing, all of a sudden acute sudden pain, these are things that you want to seek emergent medical help for.
So I'm going to ask you a little bit more detail again. What is a large amount of blood? Half a cup, a quarter of a cup, a teaspoon?
That is a great question. At our center, we tell patients that if they cough up a half of a cup of blood or more within a 24-hour period, so this could be less than a half a cup throughout the day, but once you reach a half a cup of blood in 24 hours, you should be contacting an ER.
Okay. A little bit of a change. Somebody wrote in, her boyfriend has cystic fibrosis and is 40 years old. And she wants to know what key points does she need to know? How can she help support him in managing and taking care of the disease?
That's a great question. We at our center encourage significant others to come to their clinic appointments. We find this very helpful not only for the patient, but also for the significant other to feel included and to be helpful for the disease. As long as the patient is okay with this, the significant other can come to the appointment. We can educate them on the patient's individual disease process, their individual treatment plan, and educate them on their treatment and ways that they can help them at home.
Very interesting. And again, another great point as to why it takes a team to take care of cystic fibrosis. So a little bit of a switch, and that is, I hear more and more people talking about primary care providers in the CF centers. So when should someone contact their primary care provider, and kind of define a little bit who a primary care provider might be, and when should they contact their CF center?
So probably the most obvious is if you're having any lung symptoms, you want to contact your CF care team. If you're having sinus-related symptoms, you want to contact your CF care team, or if you see an ear, nose, and throat physician, you would want to contact them. If you have stomach complaints, I would definitely call your cystic fibrosis team first to let them know, because sometimes this could be related to the cystic fibrosis, and it's best to check in with them for treatment plans. They may refer you to a gastroenterologist, or they may refer you to a primary care, but it's best to at least start to touch base as well. For a primary care, some of the obvious reasons for visiting a primary care physician, these are providers in the community to care for preventative medicine and health screening. That is important to the overall health. They also can deal with injuries such as fractures or sprains that you don't want your CF care team dealing with. They can also deal with skin complaints because they can see you a lot sooner, follow up with you a lot easier, and assess you quickly. These are things we can't always do over the phone. Despite the technology today, primary care providers are excellent at providing vaccination coverage, preventative medicine, health screening questionnaire forms, and obviously for women, gynecology issues should be taken through the primary care or through their gynecologist. Now there is a gray area that's not as obvious. There could be other complaints that I haven't listed or talked about that would be best if you talked with your CF care team, and they could refer you then back to your primary care or to other specialists in the area. But sometimes it's a good idea to check in because you may need some counseling or education in relationship to the cystic fibrosis disease.
Thanks a lot. And just to reiterate, because it's always important, it's very important for people with cystic fibrosis to get their flu vaccine every fall.
Very important.
So now I want to ask you, as a nurse in the adult CF clinic, how are you involved with the transition and transfer of the people with CF from the pediatric clinic to the adult clinic?
As a nurse, I attend monthly meetings that we have with the pediatric team. The pediatric and adult teams get together on a monthly basis to discuss patients that are ready for transitioning. The pediatric team has already been working years for this process. At the time of the meeting, they educate us on their medical and psychosocial issues. After that meeting, one of our physicians will go and meet the patient at a pediatric appointment. This is more of a friendly visit from our team. Once the patient has been transitioned into the adult clinic, I will introduce myself, educate them on our adult program and any other education and information that they may need at that time.
A question that came in from the community is, what are some simple ways to reduce the risks of lung infection?
That's an excellent question. I probably don't have the $1 million answer for this. But some ways, first of all, is what we kind of talked about in the beginning, or what Leslie had mentioned, is partnership is extremely important with your care team. This does take a team approach to take care of a cystic fibrosis disease, and it's really important to work together as a team. Other ways is taking your prescribed medications, adhering to the treatment plan, or discussing with your providers or your nurse if there's a problem with your plan. Talking with your physical therapist or respiratory therapist about airway clearance or an exercise program, talking with your nutritionist about weight goals, and maintaining your nutritional aspect of your cystic fibrosis disease. If you are diabetic, it's important to keep your blood sugars within control, because this will also help you with your cystic fibrosis disease. And getting the proper immunizations are important. And also during the flu season, it's extremely important, and throughout the year is proper hand hygiene as well.
Oh yes, that good old, you gotta wash your hands. Seems like I heard that from my mother a number of times growing up. Somebody wrote in and they prefer to be proactive instead of reactive in their care. So how as a healthcare provider, do you want to hear from the patient or the family member to help you be proactive if they don't think you're being proactive enough? How would you like to be approached?
I would like, which might be a little bit easier for some of the patients to be able to approach me just because they're talking with me on the phone and seeing me in clinic. I think the best thing would be to say it straight to me, that they want to be more proactive and they don't feel like they're getting that, or they feel like maybe they're getting ignored, and they feel like for them to take care of themselves, I need a more proactive approach. That's how I need you to help me to take care of my disease.
Good tips. One final question, and that is, what can patients, families, and friends do to help the person with CF stay healthy and extend their life expectancy?
Some of that goes back to the partnership as well, and some of those ways of trying to stay healthy. It's really important for family members or significant others to really know that the patient that has the cystic fibrosis, to know their baseline symptoms, because sometimes they're more aware of when a baseline symptom has changed and alert them, you need to call your CF center. Also, to be aware of their treatments and medication plan and care plan is extremely important, because they can help, obviously not doing the treatments themselves, but doing behind the scenes help of the medications and treatments by cleaning the nebulizer cups, by maintaining the compressor, by knowing some of the insurance issues and hassles, by making sure the prescriptions are refilled on time, and organizing all the medical information and bills and paperwork that you get as part of this.
Well, thank you, Megan. Thank you very much for answering the questions.
Thank you.
Remember, being a full member of your CF team is important in order to help you or your child with CF thrive and to learn how to fit CF into their life versus their life into cystic fibrosis. So there are a few other things and tips that you can do to learn more about CF and how to manage the disease. First, please talk to your CF center nurse. They're a great wealth of information. Also, the Cystic Fibrosis Foundation's website has additional information. In Living with Cystic Fibrosis under the Staying Healthy section, there's information related to nutrition, respiratory care and lung health, as well as insurance coverage and patient assistance programs. In the treatments under therapy section, you can learn more about the different drugs and treatments used for cystic fibrosis. And Megan mentioned at the beginning, reading CF care guidelines. Those are also available in the treatment section under CF care guidelines. However, I do want to say at this time, not all of the care guidelines are publicly available due to copyright restrictions from the medical journal in which they were published. When they are available, the foundation will post them on their website. I also want you to read, or you can also go to the medical journals online at pubmed.gov. This is a database of information in all the medical and scientific journals that have been published. NIH, the National Institute of Health, also has medlineplus.gov, which is information for patients, families, and their friends about different diseases, conditions, and wellness. HopkinsCF.org is the website for the Johns Hopkins CF Care Center. This webcast is part of the Partnering for Care series that will be on the Cystic Fibrosis Foundation website. This series includes such topics as partnering for your child with CF, as an adult with CF, during the transition into adult care, when you're thinking about lung transplantation, what it means to be a CF Foundation accredited care center, how to work with your dietitian, your respiratory and physical therapist, your social worker, your psychologist, so you or your child with CF can thrive. I also want to encourage you to watch an archived webcast on the CF Foundation website. You can learn more about germs and infection control, healthcare coverage, building life skills, and more. This concludes the CF Foundation Education Day, Partnering for Care. Help your nurse, help you thrive. I would like to thank you for watching and submitting your questions. Meghan Ramsey for answering those questions very well. And I'd like to also thank Rick Vest and the technical crew, Emily Ann Powell, Melissa Chin, and the Cystic Fibrosis Foundation for making this webcast possible, Genentech for their unrestricted educational grant. Thank you.